Hello everyone and welcome to the first week of the Australian IVAS course. My name is Ulrike Wurth and I'm currently the Executive Director of the Australian College of Veterinary Acupuncture, or ACVA for short, that teaches the IVAS course in Australia. I'm also one of the senior lecturers. I graduated from Melbourne University in 1972 and set up my practice in Hythe and Geelong in 1979. Initially it was a mixed practice and that became a small animal practice as the surrounding farmland was subdivided for housing. Being a veterinarian has been a delightful career for me, and I've always enjoyed surgery and the challenge of a medical diagnosis. I thank a lovely big white cat called Ben and a lovely Doberman called Tia for my acupuncture journey of 33 years. After Ben, who had a paralysed bladder for 8 weeks as the result of a car accident, started urinating after one acupuncture treatment from a human acupuncturist, and Tia, who had acute neck pain, recovered after 2 treatments, I knew I needed to know more and enrolled in a 3-year part-time human acupuncture course, and the rest, as they say, is history. The first few lectures I attended, the traditional Chinese medicine, or TCM for short, seemed like a lot of mumbo-jumbo to my Western-trained left brain, but I had seen the amazing positive results, and I knew I just had to persevere to try to understand this new system of looking at the body and develop a new section in my brain called TCM. I found I loved the philosophy behind TCM and found that TCM can explain so many aspects of day-to-day life as well as clinical cases. In 1986 I graduated with a human diploma of acupuncture, and since that time have been using acupuncture in my practice on a daily basis. Since the very first Australian IVAS course in 1991, I have been teaching acupuncture to veterinarians, and I still find it stimulating and enjoyable, and I still find I'm learning new things all the time, and I'm still finding acupuncture amazing at times. In 2010, I sold my practice and now work 1 to 2 days a week treating patients only with acupuncture and Chinese herbs. Since 1983, when I started learning acupuncture, I have developed a deep respect for the body's innate ability to heal itself, although at times it does need a little help. The body is really amazing in terms of being able to heal itself. Many of my patients are geriatric dogs and cats, and the changes that can occur with acupuncture can improve their general health and well-being and enjoyment of life without any of the side effects of drugs. I find this particularly rewarding, as well as being able to treat lameness cases that no one else seems to be able to diagnose the cause of. Acupuncture can also be used in conjunction with medications to give a greater effect. What I like about treating patients with acupuncture is the ability to insert a few needles and stimulate the body to heal itself, or at least be as good as it can be under the circumstances. Our first lecture for this term is an introduction to some of the concepts and theories of TCM and acupuncture and an overview of the course. What I would like you to do is sit back and listen to the lecture and become familiar with some of the terminology. It's a bit like learning a new language. Keep in mind that everything I'll be introducing will be covered in greater detail during the first term, which focuses on the basics of TCM. As you can see from the website, there are a number of activities for you to do each week. If you find yourself short of time, make sure that apart from attending the lecture, you complete the quiz, which is great revision, and also look at the channel activities. This week is the lung channel activity. Find the listed major points on yourself, join the dots, and get some idea of where the lung channel is located on the forearm. You can do this on your dog as well. Don't worry too much about any details. This will come later in the workshop. At this stage, just a general idea of where the lung channel is good enough. Each week there are more channels to locate, so that by the time of the workshop you will have a good idea of where the channels are located on the body and their relationship to each other. I'm sure that listening to the lecture will stimulate a lot of questions, and I look forward to your questions in the chat room next week. Alternatively, you can also put questions on this discussion forum. So until next week, goodbye for now.